Frequently asked questions about AMH. If you're a lady who is trying to conceive, I'm sure that you must have heard about AMH at this time, and you might be wondering, what is this AMH? What does it tend to achieve when my doctor sends me for an AMH test? And what are normal AMH values? What does it mean when my AMH values are low or very high? What does it mean for me in my trying to conceive journey? I am going to be answering all those questions in this video. Hello everybody, I am the Wongo Nation President. I talk about everything fertility, and I also use my platform to educate women about ultrasound and the need of ultrasound in pregnancy. So today I'm going to be talking about AMH level and every question that you would have, just in case your doctor sends you for one. So in this video, you'll be learning the normal values of AMH, what it means when your AMH levels are low or high. What is the meaning of AMH? AMH stands for Anti-Müllerian Hormone. This hormone is produced by the granulosa cells of your ovary. This particular hormone helps your healthcare provider to know the number of eggs that you have in your ovary. Backstory: when you were in your mother's womb, all the eggs that you need throughout your reproductive years is formed. At the time you're born, you have almost 800,000 eggs. By the time you get to puberty, the number of these eggs that you have in your ovary will start reducing on a weekly and on a monthly basis. By the time you hit 35, you might have lost more than 70% of the eggs that you had. Now, when you are going through fertility challenges, you need eggs, because it is this egg that would lead to ovulation, and then when you have sexual relationship with your partner, the egg is fertilized and then you get pregnant. If it is a situation where you no longer have viable eggs in your ovary, it becomes a problem because you can no longer achieve pregnancy at that point. Now, when you are going through fertility challenges and you have tried for a while, you're not getting pregnant, your doctor might want to check whether you have enough eggs in your ovary and also know whether you are ovulating. If you want to know whether you're ovulating, there are certain tests that you can go for example, follicular tracking. You can also be told to do progesterone test 7 days to your next period, or you might need to do basal body temperature tracking at the comfort of your home. However, another test that your doctor might send you for is the AMH test. This AMH test tends to check the number of eggs that you have in your ovary. Now, it is simply a marker of the number of eggs, because I've heard some people say that it checks the quality of your egg. Not at all. It only talks about your ovarian reserve. This ovarian reserve is in connection to whether or not you're going to respond properly to fertility treatment. Here is the normal AMH level. As you can see, it is calculated by age. That is because the number of eggs you have in your ovary tends to reduce with age. By the time you hit 35, the number has reduced drastically, and that is why this AMH level is usually offered to ladies who are above 35 and are trying to conceive. Your doctor might consider you going for AMH level tests if you are younger, just in case you want the pregnancy as quickly as possible, and if you've tried for more than 1 year. But usually you might not need this test if you are not trying to go for a fertility treatment. One of the major questions people ask about the AMH level is, when it is low, can I get pregnant? Like I said earlier, your AMH levels cannot tell whether you can get pregnant or not. Unlike what you might have heard, that if your AMH levels are low, you can no longer get pregnant. It is not true. You can still get pregnant with low AMH levels, because it doesn't talk about the quality of your egg and your ability to ovulate. It rather tells your doctor whether you're able to respond positively to fertility treatment like IVF, because during IVF, there are certain treatments you need to go through. They have to stimulate your ovary and harvest the follicles. So if your AMH levels are low, it might hinder that process. In fact, they might not be able to harvest enough follicles for your IVF treatment. So with a low AMH, you can still get pregnant. You need to bear this in mind. If you've gone for that AMH level test and it is low, your doctor would usually advise you to go through in vitro fertilization or assisted reproductive technique. And you'll be wondering why. Since I can get pregnant naturally with low AMH, why is my doctor asking me to go for IVF? The reason for this is because the levels don't get better. It doesn't get better with time. If it is other things like your progesterone level that can get better with time, your doctor might put you on a type of treatment plan. However, this one cannot get better. So you have tried to get pregnant for the past 5 years, only for you to find out that you have low AMH levels. Your doctor is going to say, can we try IVF? Because in the next 1 year, the level of the AMH values are going to drop again. And at that time, that means the quantity of the egg you have in your reserve is diminishing. And a point could come when they can no longer be able to use your own eggs for IVF treatment. So that is why whenever you get that low AMH value result, your doctor will be like, go for IVF right now. And you're wondering, is it that I can no longer get pregnant naturally? You can. But for the past 1 year, 2 years, 3 years, you've been trying and the pregnancy has not happened. So your healthcare provider would want you to take that action at that time. That is, if you truly want to have a baby so quickly. Apart from low AMH, people also worry about high AMH levels. So when they go for that test and they tell them your AMH levels are high, they get worried again. Now, high AMH values have been linked to Polycystic Ovarian Syndrome. I'm going to be making a lot of videos about PCOS in future, and I want you to be here while I do them. That is why I'm going to ask you to subscribe to this channel right now, because I'm going to be bringing you a lot of information about your reproductive health, and I know you're going to like it. So when you have high AMH values, it means that you probably have Polycystic Ovarian Syndrome. In some cases, it is all right. Everybody is not going to have the exact number of eggs in their ovary. You might have more than myself, and that is fine. However, if you're having things like irregular cycle, hormonal acne, growing hair around your face or around places where a man would usually grow hair, then you need to see your gynecologist to get a diagnosis of whether or not you have Polycystic Ovarian Syndrome or not. Something you should take away from this video today is, yes, you can get pregnant even though you have low AMH values. I am still your Wongo Nation president, and I will see you all in my next video. Bye.